stethoscope, doing hand hygiene to prevent cross contamination. Hello,
Hello.
my name is Ira Member, and today I am your assigned nurse, and I'm going to perform head-to-toe assessment on you. So, can you please first give me your hand?
Yeah.
Can you please tell me your name
My name is Arvinder.
and date of birth?
It's 17th May 1992.
Okay, great. So, Aminda, I'm going to do this head-to-toe assessment for you because we want to assess your baseline data, and it is very important for us. And also, your physician asked me to perform this on you. So, are you comfortable with it?
Yes.
Okay. So, are you facing any kind of pain in your body today?
Just in my right feet too.
Okay. And what make it worse?
When I'm wearing a tight shoes.
And what make it good?
In a home, when I wear a sleeper, like
And what kind of pain it is?
it's a dull pain.
Okay. And if I talk about the radiation, is it radiating to the other part or it is on the same
No,
place?
it's just on a single point.
Okay, so I give you a rating scale from 0 to 10, in which 0 is no pain and 10 is the maximum pain. So, what would you rate your pain in that?
I think it's a 2.
Okay, and at what time it happened to you?
A week ago.
Okay, so are you taking any treatment for this or you need me to ask your doctor about it?
No, I wear a bandage and I think it's recovered from that one.
Okay, good. So, before starting, let's provide your privacy. So let's start with the neurological assessment. I'm going to ask you a few questions to assess your conscious level. So where are you right now?
I'm in hospital.
And what time it could be?
It's evening.
Okay. And if I talk about with whom you are right now?
My assignment.
Great. So let's continue with the cranial nerve 3, 4, 6, and 7, in which I'm going to assess your oculomotor, trochlear, abducens, and spatial nerve. Let's start with the cola, in which we are going to check your oculomotor nerve. You have to see straight, and I'm going to fall light on your eye. So pupil are round, symmetric, as well as when light fall on it, they constrict accordingly. And let's continue with the abducent nerve, in which I'm going to check your motor response. I'm placing this pencil in front of you, and I'm going to rotate this pencil in 6 different directions, and you have to follow these directions. Great. Now to check your trochlear nerve, I'm going to put this pencil in front of you and slowly bring towards you. And when you start seeing double of it, you have to stop me. Great. Now for your facial nerve, I will ask you, can you please smile? Great. Can you raise up your eyebrows? Can you tightly close your eyes? Great. Now we are going to do a confrontation test. For this, you have to put your right hand on your right eye.
Okay.
Yeah. You have to tell me how many fingers these are.
1.
Great. Can you do it with another hand, please?
Yes, sure.
How many fingers they are?
I think it's 4.
Great. So after all my assessment, now I will give the patient GCS score as a eye response 4, verbal response as 5, and 6 as a motor response. Now I'm going to continue with the respiratory assessment. Can you please face the wall so I can check your contraction and relaxation of the lung muscles? So I'm going to put both of my hand at the base of the lung so I can check the contraction and relaxation of the lung muscles. Can you please inhale deep? Relax. Again. Great. I have seen that when patient inhale, my hands extend to upwards, and when my patient exhale, my hands come backward to the normal place, which is which is symmetric as well as normal working of the lung muscles. Now I'm going to auscultate for the lung sound. I'm going to put my stethoscope on the apex of the lung at the 2 centimeter above the scapula at the left side. Can you please deep breathe? Now to the right side. Now to check the upper 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 right lobe of the lung, I'm going to put my stethoscope between C7 to T3. Now the upper lobe of the left side. Are you okay?
Yeah.
Now at the T3 to T10 for the auscultation of the lower lobe at the right side. Now at the left side to auscultate the lower lobe of the left lung. Now, to hear the lateral side of the lung, I will ask the patient to take a Superman position and to the mid-axillary line at the level of T10. I am going to auscultate for the lateral side of the lung. From the another side too. Great. As I have done the posterior side, I am similarly going to do it with the anterior side of the lung. I will put my stethoscope at the apex of the lung or just above the clavicle line. Now at the right side. Now at the second intercostal space to hear the upper left lobe of the lung. Similar to the right side. Now on the fourth intercostal space, I am going to hear the middle lobe of the right lung. Now the left side. Now I am going to check for the lower lobe or the base of the lung and I am going to put my stethoscope at the sixth intercostal space. Similarly at the right side. Thank you. I've heard the regular sound as well as there are no non-labored breathing. Also, I haven't heard any crackling or any kind of uh, any kind of um, any kind of abnormal sound. Now I'm going to continue with the cardiac assessment. In this, I'm going to assess for the 5 different places, starting from the apex of the heart to the aortic valve, which is situated at the right side of the second intercostal space, and I'm going to hear S2 sound. Continuing with the pulmonic valve at the second intercostal space, similarly I'm going to hear S2 sound over here. Now at the left side on this third intercostal space, I'm going to check for the Erb's point, in which I'm going to hear S1, S2 sound. Now at the fourth intercostal space, I'm going to check for the tricuspid valve and I'm going to check the S1 sound over here. Nice. Now I'm going to check for the mitral valve just between the mid clavicle line, and I'm going to check for the apical pulse for 30 seconds. Thank you. As the pulse is regular, I have checked for the 15 second and then multiplied it with the 4, and with that I got the pulse rate as a 70 beats per minute. The S1, S2 sounds are present and regular. Now I am going to check for the abdominal assessment. For this you have to lay down please. So by any chance you are on your periods or you are pregnant?
No.
Okay. So when did you last void?
In the morning.
And when did you last pass the bubble?
Well, bowel in the morning and void, I think it's a half an hour ago.
Okay, great. So I'm going to first inspect, and for the sake of video, I'm not going to uncover the patient completely. So I am seeing that patient skin color is pink. There are no lesions or no scars on the abdomen. Let's continue with the auscultation. And in auscultation, I am going to check for the bowel sounds if they are present or not. I am going to start from the right lower quadrant of the abdomen, continuing from the upper right quadrant of the abdomen. Similarly to the left upper quadrant of the abdomen. Now at the left lower quadrant of the abdomen. I have heard the vowel sound very clearly, and if I wasn't able to hear, then I have to follow the rule that I have to completely auscultate for the 5 minutes. Now I'm going to palpate your abdomen, and please let me know if you feel any kind of pain in your abdomen. Starting from the lower right abdomen and the upper right abdomen. So I haven't felt any kind of mass or any kind of abnormality like tenderness or rigidity on the patient abdomen. Now I am going to check for the contour as well as the symmetry of the patient's abdomen. For contour, I am going to come into the level of the patient's abdomen on the bedside, and I am going to check what shape it is. Like I can see that patient abdomen is circle, or I can say round. Now for symmetry, I am going to come to the foot end of the patient, and I am going to check the symmetry on the both side, right and the left. And I can see that patient abdomen is very symmetric. So this was all about the abdominal assessment. Now I am going to continue with the extremities. Can you please say? So in extremities, first of all, I am going to check for the skin color, any rashes, redness, on the any pressure points or any kind of lesions or deformities on the hand. Is this
It's my birthmark.
okay? I'm going to check for edema at the same time. Okay, so now I'm going to check for the nails. They are pink in color. The bed is very soft. Okay, now I'm going to check for the rigidity and the turgidity of the skin. Can you please give me your hand?
Oh, you're too much more.
Thank you. Now I'm going to check for the warmth as well as the sensation. First, I'm going to check your warmth. Patient body is warm. And can you please close your eyes so I can check for the sensation? Where you can feel me?
Well, on my right foot,
Now,
left foot.
great. So let's continue with the range of motion. Can you please stand like
Okay.
up your hands?
Yeah.
Now please down them. Now can you please straight your hands and do this? Continuing with the leg, can you please now the another leg? Thank you. Now I'm going to check for the strength. You have to oppositely force me. You have to push or opposite force.
Okay. Okay.
So I have checked the range of motion and the strength. That is very good. Now I'm going to check for the pulses. First of all, the radial pulse. Radial pulse is located at the lateral side of the radius bone at the flexure aspect of the wrist. Checking for the dorsal pallidus at the navicular bone. Checking for the trochlear where the mitral malleolus bone is present. And I have checked that the pulse is equal and the equality is equal. Strength is 2 plus as well as it is regular. At last, I will ask you if you have any questions from me.
Oh no.
And
I'm satisfied.
do you feel any kind of pain in your body?
No. No.
Okay, that was it. Thank you.